Okay, let's jump right into this. When we talk about massive infrastructure and education projects, it is so easy to just get lost in the numbers. But Mekran Medical College? Well, that's a completely different story. Today, in this explainer, we're diving into a project that represents a monumental shift in regional empowerment. We're going to explore exactly how a bold vision on paper transformed into a bustling 300-acre medical hub that is literally changing the entire demographic of healthcare in southern Pakistan. It's truly a regional pillar. To get a real grip on this, we've broken things down into 6 quick parts. First, a vision for Mekran. Then, building a medical hub, followed by academics and accreditation. After that, we'll look at highly accessible education, campus infrastructure and life, and finally, impacting the region. Let's get started.
All right, part 1, a vision for Mekran.
As I was digging into the history here, I was absolutely struck by this quote from the college's current principal, Dr. Mohammed Afzal Khalik. He says, "The young people of this region have great potential. Just like raw gems need to be cut and polished to shine, these talented individuals also need guidance and support." I just love that. It's a perfect reminder that this initiative isn't just about, pouring concrete or setting up a fancy building. It is fundamentally about unlocking the raw, untapped potential of local youth who literally had no avenue to pursue their dreams in medicine before this. Because think about it, for decades, geographic isolation was a massive, massive barrier. Imagine being an aspiring doctor from the Keech district. You actually had to leave your home entirely, traveling huge, exhausting distances to centralized hubs like Quetta or Karachi just to get medical training. And honestly, that kind of forced relocation, it's a total deal breaker for so many families. But the vision that started gaining real momentum around 2010 completely flipped the script. The goal was to decentralize that access, to bring the education directly home to Turbat. Which brings us right into part 2, building a medical hub. Now, the craziest part of this story is the sheer speed of execution. Just look at this timeline. Back in the 2013 to 2014 fiscal year, this was basically just a line item, an initiation under the Public Sector Development Program. Fast forward to 2017, and it's formally established by its founder, Dr. Nematullah Gichki. And incredibly, by May 2018, the very first batch of MBBS classes were actually underway. That is fast. But they didn't stop at undergrad. The trajectory is already pointing to April 2026 for a visit from the College of Physicians and Surgeons Pakistan to accredit postgraduate training. Talk about a rapid evolution from a blueprint to an institution producing specialized local doctors. And the physical reality of what they built? It's honestly stunning. We are talking about a sprawling 300-acre campus built directly on the M8 CPEC road, championed by former Chief Minister Dr. Abdul Malik Baloch and overseen by Project Director Dr. Manzoor Baloch. Getting this built was a monumental feat of pure political will. The builders faced incredible hurdles, everything from local security threats to the sheer logistical nightmare of hauling high-tech medical gear out to the remote Kutch region. Yet, despite all that, they actually pulled it off. They built a fully self-contained academic city. Okay, let's move on to part 3, academics and accreditation. Now, you might see these affiliations and think it's just alphabet soup, but these acronyms aren't just bureaucratic stamps. They are absolutely crucial. They are the gold standard. Being recognized by the Pakistan Medical and Dental Council, for instance, guarantees that MMC's graduates are internationally recognized and fully licensed to practice anywhere in the country. Plus, they're a constituent college of the Bolin University of Medical and Health Sciences, which firmly tethers them to the established, heavy-hitting academic networks of the wider province. And the curriculum itself? Completely uncompromising. It follows a very strict 5-year MBBS progression. It literally walks students step by step from their basic first professional sciences, things like anatomy, physiology, and biochemistry, right through to the final professional stage. That final stage is super hands-on, heavily focused on rigorous clinical rotations in surgery, pediatrics, and gynecology right at the local teaching hospital. What's really cool is that they aren't just passively teaching textbook medicine. The institution is WHO aligned, and both the students and the faculty are actively contributing to internationally indexed epidemiological research. As an example, they actually published a study on CPR awareness among MMC students right in the PubMed-indexed Pakistan Journal of Medical Sciences. So they aren't just learning, they are actively adding to the global medical conversation directly from Turbat. How amazing is that? Moving right along to part 4, highly accessible education. Take a look at this number, 12,500 rupees. That is the annual fee for subsequent years of study at MMC. Even your first year is only around 45,000 rupees. And that includes admission and PM&DC registration fees. When you stack that 12,500 rupee figure up against the absolutely exorbitant, often prohibitive costs of private medical colleges, the financial accessibility here is just staggering. It guarantees that the ability to become a doctor is based entirely on merit and hard work, not just family wealth. So how do they keep it so cheap? Well, this affordability is totally made possible by the state structure. The faculty operate as government employees under the Balochistan Health Department's Basic Pay Scale, or BPS. From the principal and professors way up at BPS 20, all the way down to the demonstrators at BPS 17, this structured hierarchy ensures a really stable, accountable, and, most importantly, state-funded teaching environment. That's the secret sauce that keeps those student costs so incredibly low. All right, let's step into Part 5, Campus, Infrastructure, and Life. The everyday setup here is incredibly comprehensive. It's a totally self-contained medical ecosystem. Students learn in massive academic blocks featuring hands-on dissection halls fully equipped with cadavers. They even have access to a specialized forensic medicine and toxicology lab that can handle DNA profiling and medico-legal investigations. For actual clinical practice, they head over to the district headquarters teaching hospital. And crucially, the campus fully supports student life. We're talking dedicated transport, sports facilities, and totally separate male and female residential hostels to make sure it's a secure, comfortable living environment for everyone. And professionalism is baked in from day one, right down to the dress code. The mandatory knee-length white overalls are required for all academic and hospital work. What's great is how it accommodates cultural and personal choices, like optional white turbans for men or white abayas and maroon scarves for women, while still keeping a highly unified look, including a mandatory maroon jersey when winter hits. Honestly, this strict uniform policy really seems to instill a profound sense of dignity and absolute equality among a very diverse student body. Finally, let's wrap up with Part 6, Impacting the Region. This might be the most impactful data point of the whole explainer. Out of the 322 enrolled students, 119 are female. In a region that previously had almost zero localized higher education opportunities, especially ones with secure residential facilities, having well over a third of the medical student body made up of women is a massive, massive demographic shift. This isn't just a number. It directly translates to a future with more female doctors serving female patients right there in those rural areas. It's a total game changer. If you take away just one thing today, make it this concept: decentralization. Turbat sits in an area where 98.8% of the population speaks Balochi. By taking resources out of centralized hubs and putting them directly into the Kech region, MMC is producing locally trained doctors who speak the language and intimately understand the culture. This massively, massively improves the doctor-to-patient ratio right where specialized, culturally competent care is needed the most. So, I'm going to leave you with this final thought to ponder. How does decentralizing medical education truly change the entire future of rural healthcare? Because when we look at the incredible journey of Mekran Medical College, it becomes pretty clear. Building an institution like this doesn't just boost a single city's economy. It literally rewrites the entire future of healthcare for generations to come. Thank you so much for joining me on this explainer. Keep questioning, keep learning, and I'll catch you next time.